Good morning.
Hi, good morning, everyone. Welcome to HCA and HCP's Emergency Preparedness Forum. I'm Arianna Stone, HCA's Director of Research and Development. I will be co-hosting today's forum with HCP's Senior Associate for Public Policy, Carole Deyoe. A few housekeeping items before I pass it over to Carole for her opening remarks. Today's forum is being recorded, and the recording will be made available as well as the presentation slides. These forums are meant to be interactive, so feel free to ask any questions, share your comments, and utilize the chat. Carole, Taylor, and other members of the team will be monitoring the chat throughout today's forum. And lastly, your feedback is important to us. Please complete the forum evaluation at the end of today's forum. With that, I will hand it over to Carole for her opening remarks.
Hi, thanks, Arianna. HCP is so thrilled to continue our work with HCA, with the New York City folks in emergency management. This forum is one of two that we'll be presenting this year. So our next one, I believe, will be in March. And the associations also produce webinars on our own, independent of the other. And those
Welcome
are always...
to Zoom. For your...
If everyone could just mute themselves, that would be super helpful to avoid any interference with the speakers today. So all of the materials are grant funded, so everything is available free to the public. All of the webinars and the slide decks are available and posted after the presentations. So if you have somebody that says, oh, I missed it and I didn't register, they will still be able to get that information. And our weekly newsletters and monthly newsletters from the associations will repeatedly have that information and those links for you. I am pleased to also welcome for some opening remarks Fidel Monroe. She's the Senior Program Manager, Long-Term Care Bureau of Healthcare and Community Readiness at the Office of Emergency Preparedness and Response with the New York City Department of Health and Mental Hygiene. She is our liaison in New York City and has really made sure that home care is involved in emergency management in the city. So I'll turn it over to Fidel for some remarks.
Thank you, Carole. And good morning to everyone. Carole just gave you the long version of my title. I am your home care and hospice and palliative care liaison for long-term care emergency preparedness. I'm in the Bureau of Healthcare and Community Readiness. My bureau supports the New York City healthcare system to respond safely and effectively in emergencies. With the support of the associations, we offer sector-based activities such as this forum with the goal of providing fundamental education aimed at strengthening the internal capacities and capabilities of the home care sector. In increasing its ability to partner with public health to improve mitigation, preparedness, response, and recovery in disasters. An emergency management assessment survey of New York City home care providers aimed at understanding the sector's emergency management and preparedness readiness, associated policies, and areas where additional support is needed was conducted in 2022. And a follow-up needs assessment was administered in 2023 by the Home Care Association of New York State, HCA, and the New York State Association of Healthcare Providers, HCP. Two of the areas assessed in these surveys were hazard vulnerability analyses and comprehensive emergency plans. I mentioned hazard vulnerability analyses as this topical area and CEMPs go together like a hand and glove. It was noted that home care agencies that reported having a CEMP could benefit from educational opportunities to enhance their knowledge of hazard vulnerability analyses and hence the agency's comprehensive emergency plans. And agencies without a CEMP could have an opportunity to develop those plans. A budget period 4, which was last budget period, Home Care Forum addressed hazard vulnerability analyses. Also, the individualized technical assistance sessions, which are provided to agency participants who are registered in the department's long-term care comprehensive emergency management training and technical assistance program offered through Incident Management Solutions, continue to address HVAs as requested. Today's forum will address the Comprehensive Emergency Plan, the CEMP, which is used to maintain operations during emergencies, improve patient outcomes during emergencies, and enable rapid recovery. Educational offerings, such as today's forum, are made possible by the funding dollars provided by ASPA's Hospital Preparedness Program, HPP, which allows us to focus our efforts on building and maintaining prepared healthcare systems. All the programs offered through the Department of Health and Mental Hygiene are free of charge to every agency in New York City that participates. So I encourage you to use these opportunities to advance the healthcare readiness of your agencies to meet future hazards in a changing world. I look forward to continuing opportunities to work with you as we build on the successes of your sector and its involvement with the New York City Healthcare Coalition. Thank you. Let me now hand it over to Dr. Elizabeth Navarro, who is the scientific advisor in the Office of Emergency Preparedness and Response in our department. She will give you a brief overview on the respiratory protection program, fit testing, train the trainer sessions being offered to the home care sector. Dr. Navarro, over to you. Thank you.
Thank you, Fidel. Thank you all for the invitation and for allowing me to talk about the program that we have in place. So this is a CDC-funded program to expand respiratory protections at the long-term care sector, and we have several activities. Unfortunately, the ones that can be offered to the home care sector is the train the trainer sessions, and we cannot offer other activities that are only that because of the grant funding stream. We can only offer to nursing homes and adult care facilities, but for the home care sectors, we are able to offer train the trainer sessions, and right now we have different sessions planned in January, February, and March in different boroughs in New York City, and you can sign up for those sessions where you are going to receive a training of 2.5 hours that reviews respiratory protections and does a hands-on training on how to fit test staff for respirators. And as we are going to give away fit testing kits, so to each participant or to each facility that comes to those trainings, and you will be able to use them to fit test as new staff that are coming to work with your organizations. So I will put my email address in the chat. You can email me if you are interested, but I am also going to add the link to the fit test, to the Calendly app, where you can sign up for the best options that are available in the different boroughs and in the different hours that we are offering. And if you have any questions, please feel free to reach out to me, and I will be working with you and assisting you as much as I can. Okay, thank you so much.
Thank you, Ellen.
Thank you so much for that update. So like Fidel mentioned, this project was supported by the Department of Health and Human Services Administration for Strategic Preparedness and Response under a grant. Both associations received. Its content is solely the responsibility of the authors and does not necessarily represent the official views of the Department of Health and Human Services Administration for Strategic Preparedness and Response. Both associations would like to thank the New York City Department of Health and Mental Hygiene and the entire team. Fidel, Darren, Matt, Danielle, we really appreciate your ongoing support. All right, time to dive into the Comprehensive Emergency Management Plan overview and training. During today's presentation, Carole and I will be reviewing the background and purpose of the CEMP, providing an overview and showing you how to access the CEMP training and materials. But before I pass it over to Carole, we would like to do a quick poll. We want to see who's here with us today. What entity type are you representing? Taylor is going to open up poll question 1 and provide us with the results.
I still see a lot of responses coming in, so we'll just leave it open for another minute or so.
Yeah.
Few more seconds to respond. We're about 75% completion, and then we'll show you the results.
Yeah, hopefully you're seeing a poll box on your screen. So you click the poll response in the poll that pops up on your screen rather than in the chat. And please mute your line unless you're a speaker. Thank you.
All right, responses are slowing down. We're at about 80%, so I'm going to end the poll and share the results. Looks like we have a lot of representation from LICSAs today, some members from CHAS and CDPAPs, and a couple of partners and some other. Thank you all so much for being here with us.
Thank you, Taylor. It's so nice to have a mixture of folks joining us today. And without further ado, I will pass it over to Carole.
Okay, so we are here for a little while. We're going to be chatting about CEMP, the background on a CEMP, which is a comprehensive emergency management plan, and why you need one. Next slide, please. Thank you. Just as by way of background, the Home Care Association of New York State, which is HCA, and the New York State Association of Healthcare Providers, we call HCP, along with the Hospice and Palliative Care Association of New York State, we are all deeply engaged in activities related to strengthening your emergency preparedness and response as a sector and better integrating our home care and hospice sectors into related state and local efforts. We've been working with New York City for a couple of budget periods now, and it has really elevated home care in the eyes of all the emergency management teams in other areas of healthcare. We work collaboratively with the State Department of Health's Office of Emergency Preparedness and Response, New York City DOHMH, as we talked about. We have priority initiatives, most of them based on the assessment that Fidel referred to. So we need to know what you need from us. So never hesitate to reach out on that. So as far as this CEMP goes that we're going to talk about today, from 2021 to 2023, through a grant from the State Department of Health's OEM, the associations adapted and revised the nursing home CEMP for use in home care and hospice. We went through every page, every word, bit by bit, to adjust and adapt all of the language so that it applies to you in home care and hospice care. And that's what we're going to cover today. Next slide, please. So what is a CEMP? A CEMP is a comprehensive emergency management plan. This is your playbook, your script, your homework, all of that rolled up into one. It is the document and documents, I should say plural, that you will use to describe how you're going to respond, how you're going to recover, how you're going to prevent hazards. It is hazard and risk-based for your organization, and we're going to go into that a little bit more. It is comprehensive, covers so many things that you never even would think of. It's scalable for a small organization or a big organization. It's flexible, and it serves as a huge information resource. There are tools, there are checklists, there are contacts for you in this document. We want to remind you that this is the state-developed document that we worked on with New York State DOHMH, that CEMP, and the training that Arianna is going to cover a little bit later on. This is not a requirement for you to adopt, take up, take from. This is a tool for you to make it easier for you to create your own CEMP and have your own tools for your organization. You can adopt some or all of the materials. You can use it as your main document. If you don't have a CEMP, you can take a look at it and say, geez, we have a pretty good CEMP, but we missed X, Y, and Z. And take what you need from it. Use all of it or some of it. This is not required by either the state or the local offices of emergency management. Next slide, please. So why do we need a CEMP? We want to describe your approach to mitigating or preventing the impact of any kind of incident. How are you going to prepare? How are you going to respond? And how are you going to recover from incidents such as natural disasters, man-made incidents, organizational emergencies? People often think of emergency management on such a grand scale, coastal flooding and the winter storms we've been talking about, and different things like that. But you might have an organizational emergency. You might have a sprinkler system gone wrong in your facility. You might have some kind of communication breakdown that's specific just to your organization. That's an incident as well. So big, small, the CEMP is meant to help you with all of those things. Keep in mind, as you're putting together your CEMP, a couple things I want you to always remember. Your CEMP needs approval by an officer of your organization. So this is not something that somebody just in your emergency management department, and I use that term loosely because a lot of you are small agencies and don't have an emergency management department, right? And we'll talk about that. So it needs to be approved by somebody in high management. And you also need to know when you update your CEMP. That is not just for this document, that's for any CEMP that you create, that's New York State best practices and requirement. Always, anytime you make a change, note it so that you know when those changes happened. So we're going to talk about mitigation, preparedness, response, and recovery. Next slide, please. We are going to have another quick poll question because we want to know who you are on a geographic level. So if Taylor could launch the next poll, we want to know, does your organization provide services within the 5 boroughs, even if it's just one borough? We want to know, are you New York City folks? So that is open. If you could click on your screen, yes or no, and then hit submit. Hopefully everybody's able to click in.
I see responses still coming in steadily, so we'll give it a few more seconds.
Great,
We're
thank you,
almost at
Taylor.
around 80%.
I think 80% is pretty good. If you want to close it and show us who's here, because this webinar is intended for New York City, but is open to everybody. Look at that, 99%, Fidel. Woohoo. So we have New York City represented
Excellent.
very
Excellent.
well at this webinar. Great, thank you.
Everyone.
And next slide, please. So now we're going to go through some highlights of the CEMP materials, from mitigation to recovery. And then we're also going to touch on some elements of emergency preparedness that will run continuously through all of these efforts. Next slide, please. So before I even jump into this, I want you to know that the CEMP template and training has 3 parts to it. And after we finish reviewing it, like I said, Arianna is going to talk about how you access that. It can feel a little bit overwhelming. It was to me when I first started on this project in 2021, because there are 3 parts to these documents. On the bottom of each slide where we have an illustration or a page from any of the documents, you will see the reference that shows where that document came from. So for example, on this slide, we're going to talk about hazard vulnerability analysis. On the bottom, you see it came from the CEMP template, part 3, page 7. So a lot of these slides are going to jump back and forth between the template or the instructions or the toolkit. So when you're going through this, we advise that you have all 3 documents with you so that you can find, exactly what you need, especially when you're going through the training. You're definitely going to need all 3 of those documents. So just note that they're on the bottom. Anytime you need to find anything that's in here, Arianna did a great job of referencing that for us. So here are some examples of HVA tools that you can use to conduct your organizational specific HVA. Can't stress enough that an HVA is unique to your organization. It is personal. There are many hazards that are common to all of us in home care, right? Coastal flooding threatens everybody. Transportation breakdowns, if something happens with the subway, threatens all of us. But then there are things that are relevant just to your organization. Is your office located near the UN, right? If something is going on there, you're going to need to have a plan as to what to do for those types of things. hate to bring up 9/11, but the folks that were in those situations are, that close by are have very different risks than those that are not so close by. So you need to look at your organization, your census, right? Where do most of your people live? Are they all in high rises? You're going to have different risks than folks that live in pockets or neighborhoods, right? So very, very personal. Also want to remind you, as Fidel mentioned, we did an educational program just on HVA. I don't remember if it was 60 or 120 minutes long, but if you want a real in-depth deep dive into how to do an HVA, that is a great resource, and it is available through our websites. And I would imagine, Fidel, you probably have it posted on DOHMH too, but we will make sure that you have those references. So if you want to dive in, the first one listed here is Kaiser Permanente, and I just want to mention, none is better than the other, but the Kaiser Permanente one is the one that's on the Asper Tracy website, and it is the one that we used in that webinar. So make sure you update your HVA at least annually, and anytime something changes as far as your risks go. Next slide, please. So here is another example from the template, the CEMP template, part 3. This is an activation checklist. So when something happens, you need to activate your plan, right? Get everybody in motion, get the kids in the car, so to speak, right? So as soon as you know there's a hazard or a threat, the organization's senior leader or their designee, if they're not available, is going to activate the CEMP, and that's when all of your steps that you planned out in your CEMP are going to fall into place. You're going to activate the communications plan. You're going to notify staff of the CEMP activation. We have an emergency, right? Keep in mind that this page is just an excerpt of the activation list. It is a little bit longer than this. There are a lot more things you have to do to activate your CEMP, but this is just an example. You're going to convene your incident management team. Maybe that's one person if you're in a small agency. Maybe that's 2 people. Maybe that's 50 people. Again, this is very scalable, and a lot of folks might have to be wearing different hats. But the bottom line is you're activating your plan and you're getting everything in place to follow all of your steps. This tool, if you're going to just pick and choose from the CEMP, is an excellent piece to pull out and use as your checklist. Have a couple of copies in your emergency management folder. It's a great permanent record for you on your activation. Next slide, please. Here is another one of my favorite pieces of the CEMP. This one's in part 2, just so you know. This is a chart that we put together for you to tell you who you have to tell when you're activating your CEMP, right? So where you see an M on this list, that is mandatory reporting. Where you see an R on this list, that's recommended reporting. And where you see a box on this list, that's for each organization to decide. So the M's and the R's are from the State Department of Health, telling you when you have, for example, I'm not going to say when you have a coastal storm and you activate your CEMP, you are supposed to notify your New York State Department of Health regional office. When you have that coastal storm, it's recommended that you contact your local emergency management. Local law enforcement, that's up to you. Is that part of your plan to contact them, or isn't it part of your plan? That's a nice thing about these tools is everywhere you see the blank spaces and on the forms where you see the highlights in yellow, that's where you're going to fill in your organizational specific pieces. Next slide, please. Now, I talked about your incident management team, right? This, again, is a partial list. It's from part 2 of the CEMP, and this kind of goes down the chain of command. So you have your incident commander, that's your head honcho, the head cheese, the person in charge of managing the incident. Likely going to be your top level senior management, your director of patient services. Again, where you see highlighted in yellow, that's where you're going to fill in your choice for that position. The descriptions are there. It kind of gives them a little job description of what they're responsible for during an incident. You're going to have a public information officer. Maybe you don't have a public information officer. You need to think outside of the box in a small organization. who's the best person for this job? Might be somebody in human resources. They're used to putting language together in a way that everybody can understand and in a way that makes sense and in a way that's accurate. So your HR person might be a good fit for that job. You're going to have a safety officer, operations section chief. There are a lot of chiefs mentioned, and it makes it sound like your organization is huge. But like I said, you may have 3 people doing one job. This is your team that you're going to assemble. Maybe not all of the positions will be activated depending on your emergency. So again, that's the flexibility of the CEMP. Also, something to keep in mind when you're putting your team together is to have a succession plan. If my incident commander is unavailable, who's going to take over those jobs, right? And that is spelled out for you in the CEMP so that you can fill in. If President Jones isn't here, then supervising Nurse Smith is going to take over those jobs. So you can fill that in based on your exact organizational hierarchy. Next slide, please. Here's a nice checklist for response. Again, a page you can just pull out of part 3 to use if you're not using the complete CEMP. Remember that in an emergency, this looks like a lot of work, right? Looks like a lot of step. This stuff is going to be happening quickly. You're going to be checking boxes. Yep, we did that. We did that. We did that. It's always best to have a checklist when you're responding because it's very easy to miss things. If you have a checklist, you can just write NA if that doesn't apply to that incident, but at least you know you looked at it and you verified whether you need to perform that task or not. Sometimes it might take longer to read all these than it does to actually carry them out, right? Depends on the incident. Again, could be something huge, could be something very small. So there's no timeline associated with this. It's just, let's get this stuff done. And next slide, please. Do we have any questions come up in the chat yet? Because you can feel free to interrupt me, Taylor, if it's appropriate to.
No questions in the chat yet, but
Okay.
please feel free to put questions in the chat, folks.
Yeah, and we'll remind folks that they will be getting these slides, so they don't need to go crazy with screen grabs or anything. And the recording, slides and recording are both going to be available to the public, registered or not. This is your tax dollars at work with grant funding, so all available publicly. So now we had our incident, we responded, now we need to have some restoration activities, right? Again, another nice little chart for you to fill in. Who's going to be responsible for cleaning up your office if you had a flood? Who's going to be responsible for making sure that all your clinical supplies are are safe and still clean and in good working order? Who is going to communicate the restoration efforts to your staff, to your patients, right? You need to have one person in charge of that so that messaging isn't coming in from everywhere. And we're going to talk a little bit more in a minute about messaging. Again, this list, nice thing to just pull out if you need it. If you don't need all the parts of the CEMP, yeah, CEMP, great chart. Next slide, please. So now we'll dive a little bit into information management because information is so important during an emergency. You have stuff coming in, you have stuff going out, you have people asking questions. You have a lot of information to get out to your staff, a lot to get out to your patients. You have a lot of information to track. Where are my patients, right? Did they leave and go to a family's house and not tell me? Do I know where they are? Can I get a hold of them? All of this stuff is critical in an emergency. A lot of this information gathering, sharing, tracking can be done on paper in an emergency. You never know when your connection is going to go down. So there are certain things that you are going to want to indicate in your CEMP that be done on paper. Again, that is up to you and up to your organization, how you handle that. But remember how important documentation is during and after the incident, especially. And this is a common theme through all of this in your prep, your response, and your restoration. Documentation is absolutely critical. And again, depends on the event. You're going to want resident data, patient data. You're going to want staff data. Where is everybody? Did they make it to that house to have that appointment? Did they make it home from that appointment, right? Because you're not only responsible for your patients, you're kind of responsible for your staff in an emergency. We want to know where they are, and you're going to want to share information with them. Next slide, please. And now we're going to have a poll question because I want to know what everybody uses to get these messages out to staff and or patients. So if you have a mass notification application that you use, here are a few examples, Everbridge, Axis, Alert Media, or do you use the one that's offered by your software vendor because it integrates with maybe your EVV system or your EMR, or do you use something else entirely to get messages out to patients and staff? So just click on the screen, answer the poll. And if you don't use any mass application, just choose other.
We're at about 50%. I'll give it another few seconds.
Okay, thank
Answers are
you.
still coming in quickly.
Thanks. And it could be that the person on the webinar doesn't know, right? So we probably ought to have offered that, I'm not sure, option, but just choose other if you're not sure.
Responses are still coming in steadily, so another few
Okay.
seconds.
Well, that's great. That means folks have it on their minds and they're using. So while those are coming in, I will give a plug for HCP's last webinar on emergency management was on this exact topic, mass notification applications. So that webinar recording and slides is available and posted on our webpage. There's a YouTube link, so it's out there in the world for YouTube if you want more information on this topic.
All right, I'm going to close the poll and share the results now. We
Great.
reached a
Critical mass.
Mhm.
Okay, most people chose other or the one from their software vendor. I'm gonna have to dig in a little more on these software vendors because it looks like a lot of people are using that. Thank you very much. Appreciate your engagement, everybody on the line. Next slide, please. So continuing with communication, here we have another very, very handy checklist for you that you can pull out of the CEMP to use. So you're going to designate and train your personnel. That public information officer needs to have a heads up that they're the public information officer and what their jobs are. So that's a very, very important job, which does require some advanced preparation. You're going to always want to use consistent messaging. Cannot stress that enough. You need to speak in a single voice. Never, ever speculate on information. Never use social media posts to inform your decisions or the information that you're sending out. Please only use reliable sources, such as the state and city departments of emergency management, when you're getting those important messages out. You need to make sure that your staff are all getting the same message, that your patients are all getting the same message, because as we have learned with social media especially, and especially over the last few years, misinformation can really muck up the works. And you don't want to muck up the works when you're having an incident, for sure. That public information officer is the only one that speaks to the media. Okay, if you have just random staff people talking to the media about, yeah, my boss told us to do this, or that is not good, it doesn't reflect good on your organization, you want to have that one voice. So keep that very in mind, very much in mind. Make sure you have very clear policies on that and that staff are trained what to do, what not to do, who to talk to, who not to talk to. Next slide, please.
We do have a question in the chat.
Okay, great.
In the case of emergency, how early do you prefer to notify the patients and ensure their safety?
That is a question for the masses. Fidel, I don't remember what we had on our assessment. As far as times go, do you remember?
No, but I can look that up for you.
Okay, Fidel's we did an emergency management assessment in home care, And we ask that very specific question, how quickly can you let your patients know? And keeping in mind that it's not a strict guideline. It's not the state or the city says you must do it in this period of time. It's a best practice. And it also may vary depending on the emergency, right? So thanks, Fidel, for grabbing that for us. And just pop it in and just speak up when you do find it. I'm a mom. I'm used to being interrupted, so no problem. So again, here's a great checklist for you for communication purposes. And next slide, please. What conversation is complete without finance, logistics, and administration, right? Money matters. We don't want to say it out loud sometimes, but you're losing money in an emergency. You want to track your expenses. You never know when grant funding is going to come through, when FEMA money is going to come through. We have folks from the Buffalo Blizzard of 2022 that saved every receipt for everything that they spent, because you never know when some help is going to come. And if you don't have anything documented, no help will ever come. You want to make sure your administration is cohesive, that the plans are all being followed. You want to have your logistics nice, cut and dried plan. Doesn't always go that way, right? But if you at least know what general direction you want your organization to be going in an emergency, you're a step ahead of a lot of folks that don't. You want to know, who do you have agreements with? Do you have a memorandum of understanding with a supplier or with a sister agency who might be able to provide you with staff if you need extra staff in your location and they can spare somebody? You need to know where all of these documents are and what they are. Next slide, please. Thank you. Plans, policies, and procedures. Another thing I can never stress enough is you need policies and procedures for all of these activities, okay? The way that you carry them out has to match your policies and procedures, because that's going to matter to a surveyor. That's going to matter to the cohesiveness and the organization of your business and your operations. So make sure you always have policies and procedures to go along with everything. This is another handy checklist, part 2 of the CEMP. You fill in who's responsible for each of these things. Who's going to update the risk assessment? Keeping in mind that one person is going to be in charge of it, but a lot of people are going to contribute to your risk assessment, your HVA, right? But this is just saying the responsible party. Review and update patient contact information. Maybe you list all staff there. Everybody's responsible for that. Because if you don't have updated patient and staff contact information, your emergency management plan is not going to go very well when you can't reach people. So you want to know who's responsible. Next slide, please. Oh, you know what? Go back one slide. I'm sorry. Couple things I also wanted to mention. This is one of those documents that you want to update more often than annually, because you're going to have staff changes. So anytime you have a major staff change, if you have an administrative change, management change, you're going to want to pull these documents out and say, you know, is Johnny's name on any of these lists? Because I got to replace his position and I have to train that new person in that position. So you want to refer to this anytime you have major staff changes. Anytime you have a major organizational change. Did you absorb another agency's patients, right? That maybe grew your patient base, also grew your staff numbers. You're going to want to look at this stuff and say, do I need more people in charge of this? Because there's more to handle than now. And do not ever forget ongoing staff training. So when you get those new people, make sure that they're trained appropriately and frequently. Okay. Now, next slide. Thank you. Authorities and references. There is a laundry list in the CEMP document explaining where most of this information stems from, who's in charge of telling us what we can do, right? Where the regulations come from federal conditions of participation that come down from CMS. There are a lot of hospice and CHA pieces that are part of the federal conditions of participation. Homeland Security at the federal level is involved in writing some of this material or, outlining some of this material. We have New York State emergency preparedness regulations. We have other New York State statutes, regulations, minimum standards, authorities. We have DALs, DAL DHCBS 16-11, believe it or not, is from 2016, is a go-to reference for what your requirements are as far as emergency preparedness for your home care organization. Keep in mind that hospice providers have additional regulations and requirements to follow, especially if they have an inpatient hospice facility. Public health laws, there is, like I said, a laundry list way too uninteresting and long for this slide. Do we have any? Oh, I will share that DAL in the chat. Yes, I will. Thanks, Lisa. Do we have any other questions on this section before I turn it over to Arianna to talk about how you get to these materials and how you get to the training? I'll put the DAL in the chat. And somebody asked which DOH regulations. Like I said, the list is in the CEMP. There is quite a lengthy list, which actually took us months to compile, if I remember correctly, Fidel. All righty. I am going to turn it over to Arianna to talk about how to access all of these wonderful tools and the training.
Great. Thank you so much, Carole. Before we dive into the materials and how to access the training, I wanted to see how many folks have already started the CEMP training. Taylor is going to open up poll question number four.
Thank you all for responding. Answers are coming in very quickly, so I'll wait till they slow down to share the results.
Great, thanks, Taylor.
All right, it looks like we've hit a critical mass. I'm going to share the results now.
All right, so it looks like majority of folks have not started the training yet, which is great. So I'm going to walk you guys through how to access the materials through the health commerce system, as well as how to access the training through the LMS. So first, I'm going to start off with the health commerce system. The health commerce system, or the HCS, is used by the New York State Department of Health to communicate important and time-sensitive information to healthcare providers. Regulations require home care providers to keep HCS information up to date to optimize communications in emergencies and enable agencies to perform mandated functions. So first, to access the CEMP course materials, you either are going to register for an account or log into the health commerce system with your username and password. If you forgot your username or password, you should select forgot username or password. It will then prompt you to enter additional information. And as a reminder, earlier this month, DOH has added extra security to forgot password for HCS users. So if you choose to reset your password, you'll be prompted to use your driver's license or your permit or a non-driver photo ID number as part of that request. So I just wanted to remind folks about that. But like you can see on the screen here, you enter your user ID, you enter your password, and you can log in. So once you are logged into the HCS, your screen will look similar to this. On the top right-hand side, you will see headers with some drop-down options. To access the CEMP materials, you're going to select My Content. And then you're going to select this first option right here that says Documents by Group. Once you select this, you will then see a list of folders. And here we are looking for New York State DOH right down here. So then you will select this folder. And then you'll get prompted to a few more folders. The one that says preparedness is the one that we're looking for. So as soon as you select that one, you will see this screen here. I promise this is the last group of folders. So then you'll select home care and hospice CEMP templates. Once you select this folder, the three, and you select, there's going to be two options for you. You can select the hospice CEMP template or the home care CEMP templates. And once you select, you will then see the three documents that Carole referred to earlier. We have the home care CEMP Part 1 instructions, the home care CEMP Part 2 template, and the home care CEMP Part 3 toolkit. So I just wanted to review quickly what these three materials are. And right here, you'll be able to select this and download each of these three materials. So first, we have the CEMP template Part 1. They are the instructions on how to utilize and fill out CEMP template. We have the CEMP template Part 2. This is the template for providers to complete and build their own emergency plans. And then finally, we have the template Part 3, which is the CEMP toolkit. And this toolkit includes supplemental materials to the CEMP, such as checklists and guidance. So once you have all those materials downloaded, you can head over to the learning management system through New York State Department of Health. And so to access that training, you will, again, either register for an account or log into the LMS with your username or password. So here is the link that you guys can click. Right up on top, you can enter your username and password. If you're new, you can register right here. And if you forgot your username or password, you can click forgot username and password, and it will prompt you with a few questions to get logged in.
Arianna, we have a couple of questions in the chat about the steps. Would you mind going over them one more time?
Yes, for the HCS.
I believe they're referring to the HCS, yes.
Okay.
And remember, everybody, that the recording is available and the slides are available, so you might be able to just follow along on the slides afterwards if you need a refresher. I know I do every single time.
Yes. Quickly, I can just scroll through the HCS one more time for folks. So first, you're going to access the health commerce system. You're going to log in with your username or password. You can create an account here if you don't have one. If you forgot your username or password, you'll be prompted a few additional security questions to get yourself logged in. Once you're here, you'll see a screen similar to what you see here on the slide. You're going to select My Contact on the top right. Then you're going to select Documents by Group. Once you select that, you'll be prompted to a set of folders. We're then going to select New York State DOH. Prompted to another set of folders, which we're looking for the preparedness folders, which is on the right. One last set of folders, we're looking for the home care and hospice CEMP templates. So we're going to select those. And then we'll have our options to select either the home care CEMP templates or the hospice. And then once you select which ones you're looking for, you'll be able to download all of those materials. And again, there are 3 different documents. Part 1 are the instructions, part 2 is the template, and part 3 is the toolkit. So once you have all of those resources, you're going to head over to the learning management system on New York State Department of Health's website. And this is where the CEMP training is. So folks are going to be able to complete the whole training here. So
Arianna, I just want to poke my nose in and just remind folks that you can download all those materials and use them. The training is a bonus. So the materials are usable without the training, but they're much easier to navigate with the training. So lots of parts and lots of tools for you guys. Sorry, Arianna. Thanks.
no worries. Feel free to chime in, Carole.
We do have another question in the chat. Our organization utilizes an electronic system where we load our hazard vulnerability info and emergency preparedness information. Is it mandatory to complete the CEMP document?
This New York State CEMP that we're preparing today is not mandatory at all. You need to have some sort of comprehensive emergency management plan. It doesn't need to be a physical document as long as you have all the elements of a CEMP in some form. You do not have to use what we're presenting today, if that's the question. You can use an electronic document. Just remember that if your emergency involves a power outage, you are not going to be able to get to that CEMP to know what to do.
Thank you, Carole. Yes, these materials are just encouraged to use by folks. They are not mandatory. Okay. So to access the training, you enroll. You either put in your username and password. If you're new to the department's learning management system, you can register right below by clicking here. If you forgot your username or password, you can select forgot username or password, and you'll be prompted with additional information to get you set up with your new password or your username if you forgot it. So once you're logged in, let's see. Once you're logged in, your screen will look, let's first look at the one on the left. It will look like this, and we're looking for this course catalog on the left-hand side. So once we select the course catalog, we'll then see the screen that's on the right. So we'll be able to search the course catalog by entering the OHEP BP5 CEMP 2023 training right in the course keyword search. So once you have entered that search catalog in, you'll be able to search it. And you'll then be prompted to the course description, and you'll be able to, again, enroll in either the home care CEMP training or enroll in the hospice CEMP training. So once you select which one you would like to enroll in, you can then begin the course. So the course looks something like this. It is made up of 8 lessons, and there is a quiz at the end. I am going to review some tips and navigation to help users have an easy user-friendly experience. So this training is meant to be very interactive. All the charts, tables, and graphics are designed to be clicked through, switched over in tabs. There's graphs, there's flashcards. So viewers must hover or click over each visualization to see more information. As you can see on the screen, here are some examples of those visuals. And I also wanted to note that the course modules will not register as complete until all the interactive content has been viewed. and all of the questions have been answered. So you'll see this little lock screen right here before moving on to the next. And then once it is completed, once your module is complete, a purple bar like the one below will appear, and it will allow participants to continue to the next lesson. So that concludes my overview of the LMS and the HCS. Carole, do you have any comments before we open it up to some Q&A on the CEMP?
No, I would just reiterate what Arianna said about the interactive nature of the CEMP training. There are some things that might be easy to miss. There will be 4 things and you'll have to flip each card over. So anytime you see that little lock screen that she showed us, don't get discouraged. It just means you forgot to click on one thing, and they're not all the same. So you might have a multiple choice or a listing or lots of it's actually kind of cool. Almost gamifies it a little bit to make it easier for your staff that are doing the training. So, and again, training is not required to use the CEMP. Using this particular CEMP template or toolkit is not required, but we urge you to go check it out, take away what you will, even if it's just a checklist that we showed you today. It's all helpful stuff, especially if you're starting from scratch. But even folks that have been in this a long time might be surprised by how useful the resources are.
And Carole, before you go on, I just wanted to speak to the communication that we discussed earlier. So the survey results for the participants in the survey stated that 98% of patients and 85% of staff could be notified within 4 hours of an emergency that warrants notification. Okay, 98% of staff, so sorry for that, and 85% of patients could be notified within 4 hours of an emergency that warrants notification. But we found that that was a rather long time to notify staff and patients. 4 hours after an emergency is a rather long time. Hence, that's why we put on these forums and webinars. As Carole stated earlier, there was just a webinar and applications that help you get your message out. The poll just now also showed that there are other applications not listed, software that was used, and as Carole said, she'll look into those. But 4 hours was a long time. So we continue to train, we continue to provide resources and during forums like these to help you decrease that emergency notification time. Thank you.
Thank you, Fidel.
You're welcome.
There is a question in the chat. Who should do the CEMP training of our staff? Should it be those who do the planning for emergencies, or should all clinical staff do it?
That is a great question. Do you want to answer that, Arianna, or you want me to grab it?
You can grab it, Carole.
Okay. So the CEMP training in particular trains those that are writing the actual CEMP. So you're not going to have all of your nurses in the field participating in the creation of your plan, but anyone that is involved in the creation of the plan would benefit definitely from the CEMP training. Does that answer the question? So the folks writing the policies and the plans and procedures definitely will benefit from the training.
Yes, they said that answers the question. Thank you.
Okay, great.
There's another question. I think it was something that we had just briefly talked about. Do you have any context as to why it took as long as 4 hours?
Well, if you look at and if you heard Fidel remark that, oh, she didn't add this information I put in the chat. Phones, including calls and texts, were the primary and secondary mode of communication for most of the agencies that responded to our survey, right? This is a subset of agencies that responded to the survey. So think about how long it takes you to call 50 patients if you're using a phone, right? That's going to take 4 hours to call all those people, which is why we're trying to educate agencies as to how they could do this quicker. you know, if you don't have a mass text application and you're just texting individuals or even 10 at a time, it's going to take quite some time to notify everybody.
Absolutely correct. Thank you, Carole.
And I could actually go back to the survey results to see if there was a range reported, and that was just our final report response. So maybe we could take a look at that. There's a random question with regards to drills. Shoot. Charlotte, you can unmute yourself if you want to ask the question.
Even better, thank you.
Yeah.
Had a question. We went through DOH survey this past in the previous year in 2023 on all of our licenses, and when we were talking about EP, question with regards to fire drills came up, and different audits were asking for different things with regards to fire drills. One was saying that it should be for our internal office and how, you know, the structure of our office and doing fire drills within. And then the other other auditors had seemed to say, no, it had to do with a fire drill with our entire patient census and how we would approach mass fire, which made no sense to us because it is in the home. I wanted to know if you guys had any more clarity on that from your end.
That is an excellent question. One thing I can say is that in the association's conversations with the State Department of Health, we have stressed the need for consistency in surveyors. So like you said, you know, there were two kind of conflicting requirements that were pointed out to you. So that's one issue. And the other issue is, and I'm wondering if maybe Andrew is on the line or if Fidel could speak to this. What is the requirement for fire drills for a home care provider? Because I do not know. I'm ashamed to say I don't know off the top of my head. Arianna, do you know?
Yeah, this is Andy. I don't know the answer to that question, and my hunch is that I would expect somebody out of all these folks on the call that you would possibly know that. I've never seen anything in writing about a requirement for fire drills.
Yeah, me either.
From the state. I mean, obviously the building that you're in may have its own requirements, you know, from the landlord or from the city and so on. But I haven't seen anything from the state on fire drills.
Hi, this is Eileen Rabinowitz from Best Care. And we have several different licenses and we get surveyed separately multiple times. And we've never been asked about a fire drill with patients. We have been asked for documentation of the building, you know, the service branch or the corporate office. And I think that's primarily more a joint commission thing than DOH. But if anything from DOH, we've only been asked for the building that's servicing, never for patients.
Right. And that makes sense. And you would follow the building's plans for that. So as long as you had a copy of that in your file, you wouldn't be writing a whole new fire drill policy. And folks are generally agreeing in the chat with that. So if we find anything else, we'll be sure to you know, have Fidel get that out to all of the agencies on the email list.
Thank you very much.
Is that okay, Fidel? I'm offering up your services here.
That's not a problem. We're not regulatory.
Right. But if we find it,
yes, you definitely, because I can get the listserv. But I just to the lady's question, we're not regulatory, so we won't have information. But my background in home care, I have never heard of that either. So that's rather unusual. I know that the Department of Health has specific offices based on the region that you're in, and maybe you should reach out to them for some clarification.
that's a great piece of advice. And then just moving on from fire drills, that we had a question: what applications are others using in home care? I believe you're referring to mass notification apps. There are a bunch of them. I don't have my slides up from that webinar that we had. Before that webinar, I found at least 10 different ones. And then other people are using the one that comes with whatever software they're using, like HHA Exchange or one of those. So there are a lot of them that folks are using, and you need to choose the one that's right for your agency based on, cost and usability and all that. So I really, really urge you, if you're looking at for a mass notification system, to view that webinar. And I will, before we close here today, I will try to get the YouTube link for that and put that right in the chat. I will try. Are there any other questions on the CEMP or the training, especially for Arianna? She's, all that technical stuff is way beyond me.
And again, we'll be making the slides and the recording available so you guys can go through step by step and try it on your own. And if you have any questions or you're not able to log in to either the HCS or the New York State's LMS, feel free to contact me. I can help walk you through those processes.
And for interested folks, there are some participants that are letting us know in the chat which mass notification system they use, so that you can get some ideas of what's out there. But we are not supporting any one over the other or supporting any of the ones that are put in the chat. And I don't want you to get too hung up on that or distracted before we go on to our next exciting piece. So if there are no other questions, we'll move on to the updates. So everybody always wants to know what's the latest and the greatest in emergency related issues in the home care sector. So we're going to hit on some of those and have some time for discussion afterwards. Next slide, please. So first up, COVID-19 related and other respiratory virus related issues, daily health screenings and face coverings. So back in June, the New York State Department of Health indicated that home care agencies could switch from an active daily screening for their staff to a passive daily screening method for their staff. They didn't put anything in writing for quite some time after that. So a lot of folks were afraid to change their policies, but that is the standing recommendation from the New York State Department of Health. So what exactly is passive screening? Passive screening is screening done by posted signage, distribution of education materials. Give it to your staff, patients, and visitors. The materials have to cover COVID-19 signs and symptoms, ways to prevent infection, ways to control infection, as well as all your agency policies and procedures for any exposures or suspected or confirmed infections. So that's passive, giving people information as opposed to asking them every day, do you have a fever? Have you been exposed? You are not required to do that anymore. You still can, okay? You still can, especially if you're having an uptick in infections in your area. Just make sure throughout all of these things, what you're doing matches what your policy is. If your policy is stricter than that required by the Department of Health, in a survey, you have to be following your policy, even if it's stricter, even if it's way stricter. So make sure that your policies and your activities definitely jibe. Face coverings. So as you probably know, just last week, I believe it was, January 8th, the Department of Health at the state level put out a health advisory, or January 7th and 8th, it was the state and the city health advisors, excuse me, with similar recommendations for masking in all patient-facing healthcare settings. That is a recommendation. It is not a requirement. Keep in mind that it could become a requirement if conditions warrant. This is not just about COVID anymore. This is about influenza. It's about RSV. All respiratory illnesses are on the rise. And I'll remind you that respiratory illness is defined by the CDC as fever plus cough or fever plus sore throat, or all three. New York State right now is listed by the CDC as having a high incidence of these illnesses, which again include COVID-19, influenza, and RSV. Fewer people are going to the doctor for it. However, historically, at the holiday time, fewer people go to the doctor for just about anything. So it's not known whether that's a significant drop in visits or if that's just due to holiday weirdness, if you will, right? In New York State, influenza surveillance is posted for the week ending January 6th. Activity is still geographically widespread. Positive cases have decreased. Hospitalizations have gone down. The World Health Organization and the CDC are kind of talking that maybe we're out of the peak of our winter triple-demic, but it's only mid-January. And with the cold weather, folks are coming inside. So I wouldn't let my guard down yet. Okay. Let's just say that.
Carol, we have a question in the chat. Is there
Yes.
a template of the passive screening tool?
Is there a template of the passive screening guidance that I just gave you came from CDC and a DOH FAQ document, which I will try to get you a link in the chat before we finish up today. How's that?
Thank you.
You are welcome. Any other questions? I'm not seeing anything.
Not that I've seen yet.
Before we move on, just want to let you know that, of course, no vaccine requirement anymore. That's as of May. And the last official guidance on masking, besides those alerts, came out on February. I will put the DAL number in the chat. I can't get you the link while I'm talking because that would just be rude. Bear with me 1 second. It's DAL DHCBS 23-14 on the last one on masking. As a pharmacist, I want to say, please, please encourage vaccination, even though it's not required. COVID vaccines save lives, save hospitalizations. Flu vaccines save lives and save hospitalizations. And RSV vaccines are available for our most vulnerable elderly people. So please encourage vaccination. Your mother said it, your grandmother said it, ounce of prevention is worth a pound of cure. So prevention is always best. And we can go on to the next slide if there are no questions on those two items. Excuse me. COVID-19 herd surveys. Everyone has been begging and begging and begging for them to go away. They are not going away anytime soon. All of our recent updates, we meet with the Department of Health a couple of times a month with the associations, and we keep asking, and there is no anticipation of it going away. But thanks to everybody's voices, it has been shortened, and the irrelevant questions about vaccinations have been removed. So not too many questions. We hope it's much less of a burden on all of you. Keep in mind, answer honestly. The state needs to know what the workforce shortage is doing to access in-home care because, you know, it is a workforce emergency still, even though it's not declared. You guys in the field know that better than anybody, and we need to let them know. Somebody's asking what the rationale is, and the rationale, that's what I'm talking about right now, is to track the workforce shortages and in order to see what that's doing to access. So, you know, the questions include how many hours were you unable to serve? How many spots do you have open? Which is a very difficult question to answer. I understand that. You know, you might be able to say, well, I could take one case if it's high acuity, or I could take 3 cases if they're all around the corner, you know. So it's very variable. So that question has really perplexed a lot of you. But keep plugging away, keep answering the surveys, and hopefully someday soon we won't have to worry about workforce shortages. Regarding the healthcare personnel vaccination report, excuse me, that usually comes out around March, so it's nothing to worry about right now. The CDC does have a cool reference for you to look at in order to easily track the influenza vaccination reporting for your agency, for your staff. in case you don't have a system in place. They do offer up that reference. I will note that the date on it is kind of old, but it's still the reference that's still used. So it must have been a good one, right? Remember that section 2.59 requires masking for all of your personnel that are not vaccinated against flu. And then you're going to report all those vaccinations when that opens around March. Keep in mind, if you're reporting early, especially if you have a very large agency and a very large cohort of unvaccinated people, if you have newly vaccinated staff after you report, you have to go in and revise that report. So even if it's the day before it closes and you get somebody comes in and says, oh, I finally got my flu shot yesterday, you need to go back in and report that vaccination. I think that is it for me on these. Do we have any questions on HERT surveys, flu, RSV, COVID? I don't see anything, so I'm going to turn it over to Arianna to talk about some other hazards that we want you to be aware of.
Great, thank you, Carol. So first up, we have the winter weather guidance. On December 14th, 2023, DOH released a winter storm season 2023 to 2024 guidance for home care agencies, adult care facilities, hospitals, treatment centers, and nursing homes. So DOH advises that leadership and staff at all facilities and agencies should review their emergency response and evacuation plans to ensure procedures are up to date, understood by staff, and contact information for all key staff and response partners are current. All staff should be ready to activate these plans when needed. Home care agencies are encouraged to review patient care needs and consider adjustments of visits to ensure that level 1 patients are visited prior to the start of a forecasted storm, and that all patients are reminded of how and who to call for assistance if they lose their power or have a medical emergency. Any plans for adjusting staff schedules, prioritizing patient visits in the days immediately following the storm should be made, particularly if travel is still impeded, with a focus on reassigning staff based on proximity to patients to limit travel and reduce exposures to hazardous conditions. Agencies should also ensure that staff and their patients have enough supplies to cover a period of at least 24 hours prior to and 72 hours following the start of a storm. Agencies should be ready to contact staffing services if a large proportion of their regular staff are unable to travel and perform any of their normal visits for an extended period of time following the storm. An agency should also be ready to communicate with their patients during and immediately following the storm to perform checks on their safety and conditions of their health. A plan for managing situations where patients refuse to evacuate a hazardous situation should be developed and included in the agency's emergency response plan. And I can throw the winter storm season guidance in the chat for you guys all to review. And then moving on to the April 2024 solar eclipse. On April 8th, there will be in the roughly 100-mile, New York State will be in the roughly 100-mile wide path of totality for a total solar eclipse, encompassing the western and northern parts of New York, even parts of downstate, including New York City and Long Island, will experience a short period of darkness. This is a highly anticipated event that will have a significant impact throughout the state. It's going to bring hundreds of thousands of visitors. So we want to make sure folks are prepared about the impacts on roads and travel times. We should be aware of how this event will impact traffic and our emergency services during the eclipse. I know both associations have been involved in work groups to plan and prepare guidance and recommendations for healthcare facilities, including home care. So stay tuned for more information in the coming months.
We had a couple of questions pop in. One is about the COVID vaccines. We still need to request COVID vaccine to new applicants.
No, you do not. That requirement went away in May of 2023. If it's your policy, then you need to ask, but it is not a DOH requirement that staff members are vaccinated against COVID.
Thank you. And we have a
And I-
question here about screening.
Yeah, I'm trying to find that link. I've been
Oh, great. Thank
busy in the
you.
chat putting links up, so still trying to find that one for you.
And then one more thing about the solar eclipse. Governor Hochul recently sent out a press release on the eclipse, so I will also include that link in the chat for folks as well. I'm just going to transition over to the open discussion. If folks can continue to ask us questions, this is great participation. Thank you all. Feel free to unmute yourselves or continue to utilize the chat.
Arianna, this is Andy from the Home Care Association. On the solar eclipse, while the mass gatherings for it are not supposed to really happen in New York City, more of north and west of the city, the fact is, as you mentioned, that the eclipse will affect New York City, Long Island, Westchester, and it's not a bad idea to tell your patients about it because they may wonder why at 2 o'clock in the afternoon it's pitch black outside. So, you know, the preparation, depending upon where your patients are, may be very helpful to at least notify them about it so that they're not kind of not nervous and taken by surprise by it.
Thank you, Andy.
We have a question about the COVID vaccines. If we no longer accept COVID-19 vaccinations for new employees, do they need to sign a declination? Thank you.
No, because there is no requirement around COVID-19 vaccines at all. So it is entirely up to each organization's policy, what you do with COVID vaccine requirements, information, tracking, any of that. That's up to your policy. And I'm trying to get some of the screening information in the chat, but it told me I was talking too much and my message is too long. So bear with me.
Hi, this is Basima from CNT Home Care. So I just wanted to ask that the things that you mentioned was really useful. So the points like regarding the flu vaccine and the COVID-19. So will those be also added in the materials once we get it in the presentation? Thank you.
Yes, we can include all of these links that we are putting in the chat in our follow-up email with the slides in the presentations recording.
Thank you so much.
Thanks, Arianna.
We had a note that came through and says that for those that are unvaccinated, this group was cited years ago with regards to surveillance. So now they do random spot checks. So if you know that there is a requirement, that might be a good idea.
I'm sorry. I don't see that in the chat and I didn't really follow what you just said.
I think it was just a recommendation.
Can you repeat it though, please?
Yeah, for those that are unvaccinated, this agency was cited a few years ago with regards to surveillance. So now they do random spot checks.
Okay, and I'm not sure if that refers to COVID-19 or flu. So I want to make sure I draw the line there. COVID-19 vaccinations were required a couple of years ago, so that could be involved in a survey or a spot check. They are no longer required, so that should not be something that's ever asked about by any surveyor. Flu, on the other hand, as you know, has had requirements in place for quite a long time. So spot checks could be expected on that. If your staff person is not vaccinated, they are required to wear a mask when flu is declared prevalent in New York State, which it currently is. So just to make sure folks understand the difference between COVID vaccination requirements and flu vaccination requirements. And someone's asking about updated policies to be forwarded to the Department of Health. I do not believe you need to forward anything to the department as long as you keep on hand your old policies and your new ones have an effective date noted on them. Because trust me, when they come to your agency, they will look at them. So the one question, does it follow about masking if they are not vaccinated? I hope I answered that with my delineation between COVID vaccine requirements and flu vaccine requirements as far as masking goes.
I'm not sure if you covered this one yet. As of January 3rd this year, mask wearing in hospitals and other health settings are mandated only in New York City.
I have not seen any mandate. I have only seen recommendations by New York City and Department of Health. So if I missed something, please let me know.
Fidel, do we know whether or not New York City Health and Hospitals Corporation is requiring masks? I know that the city came out with recommendation this week about masking, but is the HHC on their own requiring masks?
As far as I know, there's a recommendation,
Right.
not a mandate. It's not mandatory, it's a recommendation.
Thank you.
You're welcome.
And then Samantha asked a question: in the event of an applicant refusing to get the COVID vaccine. I think we pretty much covered that. You have the right not to hire them if it is your agency's policy that they be vaccinated. It has to be in your policies. You can't just refuse somebody for not being vaccinated if that's not your policy. Winter weather alerts, Arianna. There have been a lot of winter weather alerts. Do we have to run emergency preparedness plan every time? Even if it was 2 to 3 days back to back. Can you speak to that?
I couldn't get myself off of mute fast enough. Andy, I'm gonna pass this over to you if you know the answer.
Yeah, I mean, I think this refers to last week when there were two major storms that were back to back by 2 or 3 days separation. And I would say that agencies should do everything they can to prepare for that. And that if that involves activating their plan or different parts of their plan, then I would say yes. I mean, because they were two separate storms and two different results from the storms. One may have been more snow, one may have been more ice or ice changing to rain. So I would say yes and defer to anybody else on that.
Thanks, Andy.
Following this home care forum, I will forward the State Department of Health's guidance as of January 8th and what was issued by New York City DOHMH yesterday, January 17th, so that all the agencies on my listserv will have it. If you're not on my listserv, I ask that you provide your contact name, email address in the chat, and the associations will pass that to me. Thank you.
Thank you very much, Fidel.
You're welcome.
I'm going to keep going down the list of questions. So Lisa is asking, do PCAs or direct care workers need daily direct COVID-19 screening? No, they do not. It was iterated verbally by the Department of Health back in June that they do not. And then an FAQ document came out later that I'm still searching for the link for you guys for, that says passive screening is fine, which means distributing information, distributing policies. Someone is asking for the link for the DAL for the COVID vaccination. I am not sure what you're asking me for, because there's nothing in effect right now requiring that. So, Andriana, if you could just unmute yourself and let me know what you mean, I will gladly try to get what you need.
I just wanted to see if there was anything in writing that we can use as reference regarding COVID vaccination.
Well, the mandate was repealed in May of 2023. I want to say, and I will try to find you something in writing, but it was pretty much plastered everywhere that that mandate was repealed, but I'll try to find you something in writing and put it in the chat. Or
Right.
maybe Ariana, if you could make a note to add that to our list of links, we'll be,
You got it.
yeah, sure, thank you. Jeffrey wants to know about masks being required. We have covered that. It is recommended, yeah, almost said that. It is recommended that healthcare providers wear masks. It is not required, but that could change any minute, right? The commissioner has the right to, if there is a, a threat of an infectious disease, the commissioner of health can mandate that masks be worn. So right now it is only a recommendation. It can be a mandate by your agency. You could say, we're wearing masks till April. You can do that. You can be stricter. Just make sure that your activities follow your policies. Somebody said, great question. I don't know which question that was, but I think they're all great questions. We had a warning on Monday in New York City.
Carole?
Emergency. Oh, is that weather? Yes, who's?
It's Annette. I'm sorry.
Hi.
Going back to the mask, how are you? I'm having connection issues. Going back to the mask, I thought we're in flu season right now, and the commissioner declared if you're not flu vaccinated, your
Correct.
staff should be wearing a mask in the home. Just confirming.
Yep.
Okay. Thank you.
Which actually, I'm glad you brought it up because I covered that when I was talking about vaccinations. But I didn't necessarily cover it with masking. So masking is mandated for unvaccinated for flu. Your workers that are unvaccinated for flu must wear a mask. That's standard every year after year after year, right? Since way before I even came into home care. So that still stands until flu is undeclared. Your folks that are unvaccinated against flu have to wear a mask. There is no stipulation for COVID vaccines with masking. There is no standard requirement across the board for healthcare for masking. Adele, I'm seeing a lot of people signing up for your listserv.
I really do appreciate that.
Thank
you.
And Lauren answered, wants to answer no, it was a great answer. And Lauren has been in emergency management for a long time. So any compliment from her is always welcome. More email addresses. Holy moly. We're raking them in here. That's fabulous.
Excellent, excellent.
Scrolling down. It's all email addresses. I'm not seeing any more
One
questions.
question pop in. For inclement weather, are we required to text all caregivers and patients with information?
Are you required to what? I'm sorry?
Are we required to text all caregivers and patients with information?
Only if your emergency management plan warrants that. So if that is one of your high risk areas and in your plan you say you're going to let people know, then you need to let people know. So that's where that hazard vulnerability analysis comes into play. If all of your folks are in high-rise apartment buildings and they don't go out and the storm is not going to affect them as much, maybe they need different messaging than your staff people who are going to be tromping around in the snow and ice, right? But that's why you need to do that analysis for your agency, decide where the risks are and what you're going to do about each. Lots more email addresses. All right, so we're going to keep this open. I'm going to go digging, and I don't know if maybe Fidel or Ariana has something to add while I dig for a
I've
couple
got a
of
couple
links.
more questions here. Is the HVA mandatory? Is there a way to maybe go over that a little bit more?
Every emergency plan needs to start with an HVA. You are required to have an emergency plan. So in that sense, the HVA is a requirement. Can we go back way, way, way back to the beginning, Ariana?
Of the slides, Carole?
Yeah, to the HVA slide, which is, I don't know,
Yep,
number
of
10 or
course.
something. So it was like the first slide in the CEMP. There we go. So as I discussed, and I gotta find my notes here, bear with me 1 second. The HVA is unique to your organization. Think about your emergency plans, what your plans might be for your home and your family, right? I'm like the queen of analogies. So my plans for a snowstorm, I live in the mountains in the Adirondacks. We have about 1.5 feet of snow on the ground. When it snows 3 inches, we don't even twitch, right? So my plan for that type of storm is going to be very, very, very different from Fidel's plan from that kind of storm when she's in the city and they have no idea what a snowplow is, right? So every HVA and hazard analysis, what are the risks associated with those hazards, have to be assessed for your particular situation. You all have different types of patient censuses. You all have different types of staff people. Maybe you're in only Staten Island and all your staff drive cars, right? Maybe you're in Manhattan and all your staff people take the bus, or all your staff people take the subway. That's why every agency has to do their own analysis based on what their situation is. If you're near the water, you have risks of flooding. If you're not near the water, you just knock that right out of your list, right? So the hazard vulnerability analysis is critical to making your plans. You can't plan without knowing what the risks are and what your hazards are. You know, when you go to this Kaiser Permanente tool, especially, you're going to see a laundry list of wildfires and floods. Do you have to worry about wildfires in New York City? Probably not. Do you have to worry about smoke from wildfires? We know now that we do. So that's something that probably everybody added to their hazards after we had those experiences last year with the smoke, right? I don't recall ever having that type of problem from wildfires before. Those are the types of things that you're looking at because you can't plan ahead if you don't know what you're planning for. Does that make sense and kind of fill in that information for the person who asked that, I hope? And then the other thing is, please, please go back and do that webinar that we did specifically on HVA building. You can go right to the Kaiser Permanente tool and follow along with it while you're on the webinar. It is a recording, you know, you're not going to get the live experience anymore, but please do go back and do that because it is a real eye-opener as to how you methodically go through. This is high risk for me. This is low risk. It's high probability. What's the probability? Right? So maybe flooding is a big risk, but is it really probably going to happen? No. Or is it going to cause a lot of damage to my operations? Is it not going to cause? So there are a lot of factors to consider, and then you rate your likelihood. For somebody in my area, an ice storm is my biggest worry. So in the summer, I'm not worried about an ice storm, right? But for you guys, maybe subway disruption is your biggest worry. You have to go through one by one and decide where your priorities are and start building out your plan from there.
And Carol, this is Andy, just to back up what you just said.
Please.
The DAL that you mentioned, which I call it the Bible for EP. It's from December 1st, 2016.
Right.
You referenced that at the beginning. We will definitely put a link when we send out all the links, but it says it right in there that as part of developing an emergency preparedness plan, you have to identify the types of emergencies that could impact your capacity to provide services. So again, it's an integral ingredient. There's no way you can develop a plan unless you first identify what the risks are that you face as an agency and your staff face, and then how you're going to address those. But again, we will put that link when we send out the links to all the other Dear Administrator letters.
And I'm putting it in the chat again so that it's front and center for everybody right now if they want it.
We did have a follow-up question.
Yes.
So every emergency preparedness has its own HVA associated with it?
Every organization has an HVA as part of their emergency management planning. So, and then each hazard that you come across, say you have, you know, your top 3 hazards are a flooding, ice, and subway and disruption, right? Each one of those might have a little bit different pathway in your plan. So for this hazard, this is what we're going to do, ABC. For this hazard, this is what we're going to do. The New York State HVA, because organizations like the state level Department of Health, the state government has its own HVA and its own emergency management plan. And you'll see that they took all of the hazards. What's the likelihood? Is an earthquake probably going to disrupt New York? No, maybe that's lower on the list. We don't need to deal with that right now. But then you can add annexes to your plan. Say for the smoke, right? So say you had a wonderful emergency management plan, you're a big agency, very well organized, and you planned for all of these things: ice, snow, flooding, chemical spills, fires, all of these things. And then the wildfires and the smoke came last year, right? You needed to get information out to patients, to staff, how to deal with this. This was an incident that, that you needed to deal with. So maybe you put an annex on your plan now, because now we know what we need to do if that ever happens again. Does that make sense?
Thank you. There's just a couple more questions.
Okay.
If we can't reach the patient through phone calls, is a text message good enough?
As long as that's your policy. Yeah. We're going to try a phone call first and a text second. Absolutely. A
Great,
lot of
thank
people
you.
use text, and that's where those mass notification things come into play, because you can write one text and it's going to go to 75 people or 750 people with those applications that we were talking about. And that is really the quickest way, because to have somebody on the phone when, they're lifting up their feet because the office is flooding is not always the best case scenario.
Thank you. We have a question about CDPAP. Is urine test required for CDPAP?
Is a urine test?
Mm-hmm.
You mean like a drug urine test?
I think so. If the person who asked that question wants to clarify, that'd be great.
Because that, two things I will say on it is that drug urine testing has nothing to do with emergency management, but we'll address the question. There are no drug testing requirements for those in home care. That is an organizational policy. So if it's the policy of the organization to test staff for drugs or illicit substances, keep in mind that if the person is 21 or over, you cannot test for marijuana. It's legal. You cannot test for marijuana in somebody 21 and over. There's my fun fact for the day.
Carol, I will add though that CDPAP, there is a health assessment required for the personal assistant. And if you look at the regulations, they refer back to the LICSA regulations. And I don't have the exact wording, but I believe it's something to the effect of the person has to be free from, I'm drawing a blank on how they phrase it.
You're right, free from addictive substances, but it doesn't mean a drug test. You could ask them questions.
Right, exactly. But I just want to make sure people
exactly.
understand that. Yes.
Oh, I'm
thank
sure
you.
glad you brought that up, because I forgot about that part. Yes. Yeah, it doesn't specify a drug test. You just have to make sure they're free of impairing substances. And I wish I had said it before we had all this good conversation, but please do the evaluation. We really, really rely on your feedback to improve these programs, to know what you need and what you don't need. We don't want to talk to you for 2 hours about stuff you don't need. So the survey gives you an opportunity to let us know how we did, how complete our information was, how engaged you felt, because if we're not engaging you, then it's a waste of everybody's time. And also tell us what you need to learn more about. It sounds like we're still working on HVAs and communication, just from this conversation, but let us know in that survey what you need so we can put these grant dollars to good use.
It looks like we got all of the questions in the chat, but if we somehow missed your question or you have another one, please feel free to unmute yourself or put it in the chat now while we still have a few minutes left.
Yeah, and if you could switch slides to our contact information, if they have follow-up questions, they can, maybe we'll put that survey link in the chat so that.
Yep, Taylor did put it in the chat.
Oh, great, thank you. Oh, I see it. It was right there in front of me too. Wow. So here are the contact emails for all of us. Andy Koski, who has piped in with great information. I'm so glad you're here, Andy. And Arianna from HCA, and then myself, and then our CEO, Kathy Fabreo, is also involved in emergency management, but I'll be your main contact at HCP. Arianna, Fidel, do you have closing remarks? Because I am tired of listening to myself.
I just wanted to thank everyone for participating today. This was a great discussion. I hope you guys learned something new. And if you have any questions on the CEMP, please reach out to us. We're happy to help you. We will be in touch with the slides, the recording today, and all of these useful links that we're going in the chat. And as well as the evaluation, like Carole mentioned, please fill out the evaluation for us. And again, just thank you all for participating today.
And actually, if you could flip the slide to the resources, I just want them to understand that there's a resource slide as well, which has links. Once you get the slides, you won't be able to link from the screen, obviously, but once you get the slides, you'll be able to link to the New York State's plan that I was discussing, to the HVA tool, to Asper Tracy, which is our federal funding source for EP, and then to HCP's Emergency Preparedness website and HCA's Prepare website. Most, if not all, of the materials produced by the grants, such as this webinar, are posted there for the public. There's no paywall, there's no membership required. This is your taxpayer dollars. So this stuff is available to everybody, whether they were here today, whether they registered today, or whether they want to look at it 6 months from now. So all of it is out there for you.
Yes, and following on that note, our New York City Healthcare Coalition site does not maintain all the recordings of each individual sector. So someone asked earlier if we can provide recordings of the webinar with the applications for communication, HVA webinars. I will ask Carole and Arianna to please add those links when they send out the programming. Also, Carole, I just sent to you, I think that's what you're looking for, the FAQ for home care. And you can include that also. I'd just like to thank you all for your dedication to this work and your partnership as we tackle important and essential issues. Again, thank you for being here today. Thank you for making your voices heard, and we appreciate it. Have a pleasant evening.
Thank you.
Everybody.
Thank you so much.
Bye-bye.
Just put that QR code back up. Oh, okay, there we go. Everybody can feel free to drop off. Just don't forget to do the evaluation. Have a great day. Stay safe with the cold temperatures.